So we started this about 3.5 years ago, and maybe 50% of people definitely have an improvement in their health, reduction in weight, improvement in their diabetes, improvement in their blood pressure, but 50% of people don't respond. And I used to wonder, why does this happen? Why do the other 50 don't respond? And today what I'm going to discuss with you is some very seminal information that's not only going to improve the health of everyone here, because this information has improved my health. It's going to improve the health of people who are already on a low-carb, high-fat diet. But it's also going to improve the health of people who are resistant to that, like for one reason or the other don't tolerate that. So I want to start out by a few questions. How many of you have, let's say, on a monthly basis, symptoms of acid reflux? So acid reflux, people are raising their hand. Okay. How many of you I need to be all gadgeted up, sorry. So, how many of you take antacids on a regular or irregular basis? Antacids? Okay, some of you. What about proton pump inhibitors? Does anybody know proton pump inhibitors? How many of you are on it?
I hate them.
What is it?
I hate them. I don't want to take them.
Have been on it, yes.
So some of you have been on it. What about
Proton.
Pepsid, Tagamet, ranitidine? Some of you. Okay. So today what we're going to do is to talk about how stomach acid is extremely crucial for our health and how it interacts with a low-carb, high-fat diet. So I already mentioned that this, what we do, has given us a purpose, and what we really talk about is nutrition, which is low-carb, high-fat, movement, which is exercise, fasting, which is another component, sunlight. This involves vitamin D and many other factors other than vitamin D. Sleep, we gave you some information on sleep in one of the seminars. And stress, I don't know how to control stress, but that is one of the those are the pillars through which you can achieve health. So tomorrow, let's say one of your doctors, let's say me, ends up having a cardiac event, and you say, hey, he's following a low carb, high fat diet, because I don't tell you to do anything that I don't do myself, okay, other than stress. My life is quite stressful for what I do. So if I end up with dementia, if I end up with heart disease, if I end up with malignancy, I don't think you could attribute that I don't follow the right nutrition. There are other factors that are involved in health. I managed to do movement right, I managed to do fasting right, I do get sunlight, and I have managed and have improved my sleep from what I have told you. Okay, now, we've been doing this for 3.5 years, and the other day a group of physicians went and complained to the administration saying that Dr. Ali is dangerous because he is telling people information about cholesterol, he's telling them information about statins, he's taking people off of statins, and this is dangerous, this is against guidelines.
Oh, yeah.
And the hospital giving him this room to support him is culpable. So I want to tell you that either this comes out of concern for their patients, probably comes out of a little bit of ignorance, probably comes out of because of the fact that they don't. I don't know what to do with this. This room always has had very poor acoustics. So it either comes because they have never really come and heard the whole presentation. I'd like to give them the benefit of doubt. But it is happening. And so tomorrow I will come in and say, hey, all of you guys need to support me and protect me. Okay, so this is a very unique concept, okay? Absence of disease is not optimal health. You can take a person and say he doesn't have high blood pressure, diabetes, obesity, but still can be depressed, may not have vitality, may be feeling tired and fatigued. So optimal health is a combination of all of these factors. So some of the things we'll be discussing, you would say, hey, I have lived without a stomach all my life and I don't have any problems. That may be absence of disease, but that is not consistent with normal health. Okay? So we said the relationship of the heart and low carb, high fat diet to acid reflux. Okay? So that's the goal that we're going to do. So this is a stomach that is filled with acid. Human digestion, if you came to the last seminar, is based on acid production. Acid production is very important. So I try to keep you guys as engaged as possible, use your time effectively. So I'm going to ask this question. Let's say you took a finger and you put it into the stomach for an hour. Okay? What do you think will happen?
The stomach will digest it.
So the stomach will digest it. You will have a severe 3rd-degree burn. And I just kind of took that image off quickly because it's even gross to look at. So for the first few minutes, I'm going to take you and tell you why stomach acid is absolutely essential for optimal health. Okay? So when you eat food, the acid that's present in the stomach hydrolyzes the protein. So when protein is hydrolyzed, it releases the acid producing cells also release an enzyme which is called pepsin. So this pepsin is absolutely necessary to break down the protein. So here is the protein, that is pepsin, then it's breaking down further as the digestion proceeds. And this is a very important aspect that I want you to understand. Our body does not want to see foreign protein inside the bloodstream. So in other words, when you take a whole protein, let's say you take egg albumin, so the body does not want to see egg albumin inside the bloodstream. It wants to break down egg albumin into individual amino acids which make up the protein, because it takes the amino acids and it makes its own protein. Okay? So that's an important concept. And if the body starts absorbing whole protein, you get a leaky gut syndrome that we will talk about in a little bit. Okay. So in the stomach, the protein digestion begins. Gastrin is something that you get secreted when you see food that creates hydrochloric acid that starts denaturing the protein, and then it activates pepsin, which then hydrolyzes. It breaks down the protein into individual components. So why is stomach acid important in digesting protein? So one of the things that I want to tell you is that if I were to ask you about the 3 macronutrients, fat, carbohydrates, and proteins, can we live without proteins? No. So proteins are essential for us. In fact, there are certain essential amino acids without which we cannot live. Okay? Can we live without fat? No. We cannot. Fat is also essential. There are certain fats that our body doesn't make that we need to eat. Can we live without carbohydrates? Yes. So our body can produce all the carbohydrate that it needs. So there are some essential amino acids, the absorption of which, these are tryptophan and phenylalanine. And these are precursors of neurotransmitters. So in other words, in our brain, tryptophan gets converted to serotonin and phenylalanine gets converted to norepinephrine. So these neurotransmitters are absolutely essential for our normal health, for our sense of well-being, for our brain to function well. So a person with low stomach acid does not dissolve these proteins, and they can have a higher incidence of depression, lethargy, tiredness, fatigue. So that's one of the reasons for having protein. Now, having stomach acid. Now, what about iron? Can you absorb iron without stomach acid? You cannot, because iron absorption depends on this iron that is in ferric form in the presence of high acid to be converted to the ferrous form, which then goes down into the intestines and in the duodenal cells get absorbed. So without the presence of stomach acid, your iron absorption is low. Now I don't want to ask you this question directly, but do any of you know somebody who's had gastric bypass surgery or gastrectomy or has had, so you know people like that. Are they iron deficient? Are they anemic? Yes, they are. The reason is that if you take out your stomach, you can live, but that is not compatible with optimal health. Okay, what about vitamin B12? Can you absorb vitamin B12 without having adequate stomach acid? So no, you can't. Because B12, there are certain cells that make acid also make a factor called intrinsic factor. So B12 is found in animal food. Can you find B12 in plant-based food? So there is no B12 in plant-based food. So are there any vegans here, people who would not eat even eggs and milk? Wow, it's a great crowd. So animal food has vitamin B12 and it's found in mixed with proteins, and the acid is needed to break down the protein to separate the, so when I get this up here it activates that. So when the protein gets denatured by the acid, the vitamin B12 is released, and the same cells that are making the acid are also making intrinsic factor. So the intrinsic factor binds with vitamin B12, and that combination then goes down and gets absorbed in a certain section of your intestines. So in the absence of acid, you're not going to absorb vitamin B12. Okay, so it's showing here the parietal cells, the same cells that make acid also produce intrinsic factor. In the presence of high acid, it combines with vitamin B12 and then it gets absorbed later. All right, what about calcium? Have you guys ever wondered about calcium? People who have low acid, the incidence of osteoporosis is increasing. So for absorption of calcium, it's absolutely essential for us to have stomach acid. So in the presence of stomach acid, calcium is absorbed, and if stomach acid is not there, the bone breakdown happens as a result of osteoclasts. These are cells that are removing bone because calcium absorption is not promoted. What about zinc? So zinc is a mineral that's extremely important in brain health and in digestion, and the zinc in the absence of stomach acid also does not get absorbed, and here it says that zinc helps you taste and smell. It's important for your immune defense. Zinc is found in high protein foods. So in other words, even though plant food has zinc, the bioavailability of zinc, the amount of zinc that you can absorb from plant food is far lower than what you can get from animal-based food. So when I talk like this, several physicians come and tell me that the stomach is absolutely unessential for a person to live.
Wow.
That the stomach is absolutely, because they have done gastrectomies since the 60s. Now they do gastric bypass surgery, they do bariatric surgery. And yes, it is true that you can live without a stomach, but that is not optimal health, because people with gastrectomy have high risks of depression. They are anemic because of iron deficiency. They have B12, zinc, folate, and calcium deficiencies. So what I tried to do for you is to tell you that stomach acid is absolutely essential for absorbing protein. And for a person who is on a low carb, high fat diet, if he's not making acid, you don't tolerate the meat, you don't like the meat. You say, no, I'm really not interested in it because I don't feel like I digest it well. So for people refractory to a low carb, high fat diet, you need to be thinking, are you making enough stomach acid? Okay. Now, this lady I said is suffering from indigestion. So here is an important question I want to tell you or ask you. Is acid reflux, symptoms of Gerd, as a result of too much stomach acid? How many of you will raise your hand saying, hey, people have acid reflux and symptoms of gastroesophageal reflux disease because they're making too much stomach acid? Nobody? No? If it is not as a result of too much stomach acid, why do you give acid blocking drugs?
Right.
What does Zantac do? What does proton pump inhibitors do? What do proton pump inhibitors do?
Block the production of the acid.
They wipe out the entire production of the acid. So if acid reflux is not as a result of too much acid, why are we giving people acid blocking drugs?
It's a good question.
That's a good question to ask, right?
That's right.
So
Yeah.
if it's a mechanical issue, that
Yes, it's
sphincter stops working,
that's absolutely correct.
and the acid escapes into your esophagus.
Right.
So don't you then have to take something to sort of decrease the acidity so you don't get like erosive esophagus and stuff like that?
Yeah, we have that. Right. And that's what we
So,
give it.
very good question here. The gentleman says that the lower esophageal sphincter, when you eat food, and I was going to show that to you in a little bit. Can I get to that in a second? Yeah, that's a good point. You had a burning question, go ahead.
Well, I thought that the body couldn't digest, so therefore it's trying to make a lot of acid to try to digest the food, but it was unable to digest it, and that's why it was making too much. That's kind of what I thought.
Okay, so let me pose it in a slightly different way. As we get older, our hair become gray, our vision goes away, we become presbyopic, we need glasses. We can't cycle as fast as I used to cycle, so we got to drop down from the racing group to the second group. Similarly, what do you think happens to acid production as we get older? It goes up, goes down, remains the same. So here is, by the way, there are 2 points I need to make. One is that I learn a lot from a lot of different people. And many of these people are not physicians. Like, for example, Jonathan Wright, the gentleman who wrote Why Stomach Acid is Good for You, Dr. Chris Kesser, many people on Twitter. So they do some seminal work which it would be wrong for physicians to just discard, saying that this is quackery. So that's one point. The second point is that I am giving nobody individual medical advice. Okay? So you need to consult with your doctor when it comes to treatment of acid reflux and Gerd. So I want to make sure that that point comes across. But here it shows clearly that as we get older, our stomach acid drops by more than 50%. In fact, if you look at women and men greater than 60 years of age, about 30% of them have a condition which is pretty close to achlorohydria. Achlorohydria meaning that their stomachs are really not making any acid at all. Okay? So Dr. Jonathan Wright says that, and he's done this, he's got a clinic in Tahoma, Washington State, and he measures acid in people. Modern medicine has gone to the situation in which almost nobody in the last 30 years that I have treated has ever had their acid measured by a gastroenterologist. But Dr. Wright does that, and he said when we carefully test people over age of 40 who are having heartburn, indigestion, or gas, over 90% of the time we find inadequate acid production by the stomach. So we already said many things, but there are some things we didn't tell. Are there bacteria in our mouth? Yes. There are bacteria in our mouth. Are there bacteria in our colon? They are, yes, because that's what is called the probiotics, the beneficial bacteria. But does our stomach have bacteria? Does a normal stomach have bacteria? Yes. So the answer to that is no. So our stomach acid is a non-specific defense mechanism to prevent bacteria from growing in our stomach and populating the small intestines. So in order to keep the bacterial level down, acid production is very important. We already talked that it's important for protein absorption. And we said that vitamin and mineral absorption. I asked that man to stay here, but I think he left. Oh, Jesus. Okay. And we said vitamin and mineral absorption is also dependent on that. When you have low stomach acid, your health will decline. We already discussed that your neurologic function, you can get depressed. There is impairment of your ability to fight infections. You lose calcium, so you get weakened bones. You get fatigued. So as a result of this, there is bacterial overgrowth in your stomach that can lead to ulcers. And poor absorption of proteins can lead to all of these health problems that I will discuss in a little bit. So here is your answer. So if acid reflux is as a result of not too much acid but too little acid, what is causing you to have the symptoms? So I go down one slide and I'll come back to it. This is the lining of the stomach, and there are cells which are called mucus cells, and they produce a thick layer of mucus. So this thick layer of mucus protects the stomach from the acid. So in other words, this mucus layer is there, and even though there is a large amount of acid, it cannot destroy the stomach. On the other hand, the esophagus has no such lining. The delicate membranes of the esophagus, when they get exposed to acid, can get damaged and can even become cancerous. If anybody has had problems with it, they can say they have precancerous or Barrett's esophagus. Okay? So it's really the dysfunction of the lower esophageal sphincter, it's called the LES, which is permitting the food to get back up. So rather than treat what is causing dysfunction of the lower esophageal sphincter, what modern medicine does is that it makes the situation worse. It says, take antacids, take H2 blockers, take proton pump inhibitors. What's going to do to your acid production? It's going to destroy it. What is going to do to your nutrient absorption? It's going to mess it up. Okay, so this is a proton pump, and it's pumping acid in, and it's an active pump that requires energy, and it is stimulated by different compounds. One of them is histamine, another is gastrin. I'm not sure we really need to know that. But I want to spend some time on this slide because this tells you the reason why we get acid reflux. So when you have low stomach acid, are bacteria in your stomach going to increase or decrease? Increase. So they're going to increase. When bacteria increase, when you eat carbohydrates, are they going to ferment those carbohydrates? Yeah. Right? So if you give bacteria 3 foods, protein, fats, and carbs, what are they going to preferentially use? They're going to use carbs. So when they use carbs, are they going to produce gas? Okay, they're going to produce gas. Is the gas going to increase your intra-abdominal pressure? It is. And when it increases intra-abdominal pressure, your lower esophageal, your lower esophageal,
She didn't leave.
There you go.
so that's why I didn't want you to leave. So your lower esophageal sphincter is going to not function well, and then you're going to have symptoms of acid reflux. So at the end of the talk, we're going to talk about strategies in which we can reduce all of this. In fact, I have several patients who said, hey doc, I started on the low carb, high fat diet. I immediately noticed that my acid reflux is better and I need to take less acid reflux medicines. So there are a few people who are telling me that, but you know, I have had a lot of people tell me. So in other words, low stomach acid, bacterial overgrowth, increased pressure in the abdomen. But we make this worse. If we are obese, our abdominal pressure is high. If we lie down after eating, you're going to get more reflux. If you bend and tie your shoes after eating, you're going to get reflux. What do? We eat large meals. So if you have acid reflux, you should eat small meals. There are certain foods, one of them that I love, caffeine, that can also, and tobacco, that can also cause acid reflux. All right, so now what we're going to do is to charter on territory that's going to get into trouble with our colleague physicians and with the FDA and with the Medicare, and going to get reported saying that this doctor says don't use acid medicines to treat acid reflux because it's going to destroy your health. So what are the medicines that we use to suppress acid? One of them is antacids. They just neutralize the acid present in the stomach, so they do it temporarily. Then there are these H2 blockers, of which Zantac, Pepcid, Tagamet, some of you are on it. And then the real big category, which is called the proton pump inhibitors, you know, the purple pill, which is called Nexium, Prilosec. So which is the second highest grossing drug in the United States?
Nexium.
So $13 billion. Nexium made $5 billion, a little behind Lipitor. So because these medicines are sold to such a degree, medical school curricula does not include the causes of acid reflux. If they taught me what acid reflux was, that it was related to low stomach acid, I didn't learn it from them. I have met with several gastroenterologists and have asked them, none of them has ever told me that acid reflux is because of the stomach is making low stomach acid. Okay, so here are the proton pump inhibitors, here are some antacids and Pepcid and others. Now these are the H2 blockers. The way the H2 blockers work is that they stimulate the parietal cells to produce acid. So in other words, histamine stimulates the parietal cells to produce acid, and when you block that receptor that stimulates the parietal cells, then you don't make acid, and that's how they block it. So what happens when you take proton pump inhibitors? Are there studies that show that when you take acid blocking drugs, what is happening inside your stomach? So there is a bacteria which is called Helicobacter that causes stomach ulcers. There are many other bacteria. Does Helicobacter go up when you take acid blocking drugs, or does it go down? It goes up. So you can see that acid suppression increases Helicobacter. What happens to the amount of bacteria in your small bowel? Does it go up or go down? So it goes up. It's called small bowel, small intestine bacterial overgrowth, or SIBO, S-I-B-O. Now, does the increase in Helicobacter damage the lining of the stomach that is making the acid? These are the parietal cells that make the acid. Does it do damage to that? Yeah. So people who are taking acid blocking drugs have a much higher incidence of what is called atrophic gastritis. What is atrophic gastritis? It is damage to the cells that are making acid.
So when you have atrophic gastritis, does that increase your risks of cancer in the bowel? Yes. So it does. Okay, so all of these things are published in several different studies. So consequences of stopping acid through acid-stopping drugs is that you increase the bacteria, you impair nutrient absorption. We discussed that in a little bit. We discussed that before, but we will kind of elaborate on that. You decrease your resistance to infections, and I will talk about that in a little bit. You increase risks of cancers, and you increase risks of something called diseases associated with leaky gut, and we'll talk about that in a little bit. Okay, so this is small bowel bacterial overgrowth. There is stomach acid. You're going to destroy the stomach acid. We said stomach acid is a barrier to entry of bacteria because whatever food you eat, it sterilizes it. The food that we eat has a lot of bacteria, and the stomach acid neutralizes that. So this is the non-specific defense that our body has. Bacteria get killed within 15 minutes inside the acidic stomach when the pH is less than 3. The lower the pH, the higher the acid. Low stomach acid from drugs increases bacterial overgrowth. So we talked about SIBO, or small bowel bacterial overgrowth. So this is the condition that I already alluded to. Somebody can be obese, but they can be undernourished. They can be well fed. You can eat all the right nutrients. You can have organic meat. You can have vitamin B12, but you would not absorb it. So low stomach acid will cause protein malabsorption that can lead to infections, depression. There's also risks of dementia with proton pump inhibitors that we will get into, insomnia, stress, iron deficiency. We talked about calcium malabsorption, zinc, and B12 deficiency. Okay? So when you have decreased acid, you have a higher pH inside the stomach, you're not killing the bacteria, you are at higher risks of these organisms from getting a foothold and causing disease. Are you at higher risk of pneumonia when you have acid production suppressed in the stomach? Yes. Why is that?
Because of bacteria.
So you constantly regurgitate some food, and that bacteria is getting into your lungs, into your windpipe. Okay? Are you at risk of having bronchial asthma if you have acid reflux or you're taking acid suppressing drugs? Yes. So answer to that is yes, because direct contact between the gastric refluxate and lung tissue leads to inflammation of the airways, which causes you not to breathe, which is bronchial asthma, because you will be regurgitating back the gastric contents. All right. We talked about depression, okay? So these are essential amino acids that our body needs and uses to convert them to neurotransmitters. Neurotransmitters are serotonin, norepinephrine, and these neurotransmitters are made by absorbing the right precursors from the protein that we eat. And if you are not having enough stomach acid, you are not absorbing the right proteins. Now, what about dementia? So do proton pumps, somebody said that they really don't like proton pump inhibitors.
That was me again. Mouthy guy.
So do proton pump inhibitors cause dementia? So there are studies that shows that they cause dementia. Perhaps the mechanism for them causing dementia is that there is a proton pump that is present inside the brain cells. The proton pump is just not confined to the stomach, but proton pump is present in many cells in the body. The brain cells use the proton pump so that they can do garbage disposal. And I'll show that garbage disposal in a little bit. So old protein that is in there gets taken up by the proton pump, degraded, and processed properly. When you don't have proton pumps working in the brain, you get amyloid deposition in the brain that leads to dementia. So it's not just your neurotransmitters being affected by lack of acid. but the drug is leading to dementia. What about the heart? Is there any connection between the heart and I guess I had one more. Okay. Is there any connection between the heart and proton pump inhibitors? Yes, there is. Because the cells that line the blood vessels, these are called endothelial cells. The endothelial cells need nitric oxide. The production of nitric oxide is reduced by proton pump inhibitors. So here are endothelial cells. They need this nitric oxide gas. But when nitric oxide is absent, the endothelial cells don't behave well. Now this is where we talked about garbage disposal, right? Our cells are constantly faced with either bad protein that is senescent that they need to remove, or they come across bacteria. So when they come across bacteria, they ingest the bacteria into something called the lysosome, which then, with the help of proton pumps, breaks down the bacteria so that it can be disposed of properly. And this lysosomal function is dependent on the proton pump. So when you look at endothelial cells in people who are taking proton pump inhibitors, they die earlier. They have a shortened lifespan. So now we move gears. So I mean, this is not an exhaustive list. I did not give you an exhaustive list of the problems you have when you are using a proton pump inhibitor or an acid reducing drug on your body. So what do? You have acid reflux, you suffer from Gerd, your esophageal sphincter is not working.
Before you move on, okay, the lawsuits on proton pump inhibitors are all about kidney damage.
There is kidney damage too.
Is that the same mechanism that the proton pumps are in the kidney, or is it something else?
So the proton pump that's there in the kidneys is supposed to exchange